Oral cancer is called the cancer of the Indian subcontinent. It's because of the rampant use of tobacco and smoking in this part of the India, which is causing rapid increase in the numbers of patients who are having this. There are certain precancerous lesions which are not cancerous, but they can become cancerous at a later date. These include white or red patch in your mouth, lichen planus, reduction in mouth opening. Now, when this happens, it is important that you meet your doctors who can then keep you under follow-up, because there is a potential that these may become cancer at a later stage. Most commonly, oral cancers will present as an ulcer in the mouth, which is not healing. There are certain patients who will come to their doctor with a lump in their neck. Other symptoms that include are there would be loosening of teeth without any cause, or if you have extracted your tooth, the socket will not heal. Some patients will have bleeding without any reason from their mouth. Now, if these symptoms are persisting for 2 weeks, even after treating, you will be requested to meet a clinician so that they can take care of you in a proper way. If you have any of these symptoms, you will be advised to undergo a biopsy, which is a simple OPD procedure where a small piece of the tumor would be taken by the doctor, and then that will be examined under microscope by pathologist. Now, if they say that you have cancer, then further tests will be done. Let me talk about a myth that is very common in this part of the world. A biopsy is not going to cause your disease to progress faster. In fact, a biopsy is the only test by which we can ascertain that you have a cancer and we can treat you at the earliest. If your biopsy is giving us a report of malignancy, your doctor may advise you to undergo certain specialized scans like CT or an MRI of the head and neck and the CT scan of the chest to map the disease or to decide which areas are involved by the disease. This is called the staging procedure. Depending upon the stage of the disease that you are in, you will be then advised to undergo surgery, chemotherapy or radiation, or a combination of these 3 treatments. It is very important to identify the disease at its earliest stage, because in that case the treatments are simpler and the outcomes are good. Unfortunately, despite being a very accessible area, many patients in India will ignore their initial symptoms and will present to their clinician in a very late stage of the disease. What this does is this causes the treatment to be more complicated, and despite doing all the treatments, the outcomes are not good, the functional and aesthetic results are poor, and of course the cost to the patients is much more. If you are watching this video and you have any of the symptoms that I have mentioned, it is important that you go and meet the local head and neck team as early as possible so that they can diagnose and treat you at the earliest to give you the best possible results. Thank you.